Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Gollin.
Hey everyone, thank you for joining us on the Gastro Girl podcast. This episode is actually a two-part episode. This being the first part are our topic, the role of shared decision-making as a pediatric EoE patient's transition to adult care. Today's guest is Dr. Amanda Muir, who is a pediatric gastroenterologist in the Division of Gastroenterology, Hepatology, and Nutrition at Children's Hospital of Philadelphia. She's also assistant professor of pediatrics at the University of Pennsylvania. Welcome, Dr. Muir. We're so excited to see you here today.
Yes, thank you so much for having me.
So before we get into our little role play, this is a little interesting episode because we're going to actually take patients through a role play of what would happen when a pediatric patient is getting ready to transition from your amazing care into the care of an adult gastroenterologist, and what would happen, what are some of the questions a parent would ask. So before we get into that, let's set the stage and give those who may not know an understanding of what EoE is.
So the way I usually think about EoE is I think of it as being a sneaky allergy. So we all know about the allergies that happen immediately. So we all know about the peanut allergy when you eat a peanut and there's an immediate type hypersensitivity where you have swelling, hives, trouble breathing, and it happens instantaneously. Whereas eosinophilic esophagitis is a different type of allergy. It's a very slow, insidious allergy that develops over time with chronic inflammation. So it's eating something like milk or dairy or something that's very common in your diet over and over and over again. And over time, the esophagus gets irritated and swollen and angry and red in a very slow fashion. And unfortunately, during that process, the esophageal diameter can get more and more narrow as you're exposed to these foods over time.
So can you explain, just for those who may not know or who may be having symptoms and they don't even know it, what are some of the symptoms that a patient, especially a child, let's talk about a child. What are some of the symptoms that a child would be experiencing that could indicate that he possibly or she could have EoE?
So that's a great question. So the age you are when you present actually determines some of your symptoms. So when younger kids present, so infants or toddlers, they tend to be the kids where you go to feed them and they turn their head and they don't want to accept food because it hurts when they eat.
Aww.
And they can't express that. And then there's also a lot of vomiting. So they tend to be the kids who are pukey kids. Every time they eat, they might puke, or, every few days, multiple times a week puking. And then as kids get older, the symptoms change. And so then the middle-aged kids, which I think of as being 9, 10, 11, tend to have more vague symptoms like belly pain, heartburn, reflux. And then as they get older into adolescence, that's when patients tend to present more with what we call dysphagia, which basically just means trouble swallowing. So it might be just a feeling of food going down that you can feel, or slow eating, where it just feels like you have to eat really carefully and chew really carefully in order for the food to go down. Patients sometimes feel like they can't get through dinner with just one glass of water, that they have to go and have multiple glasses of water just to feel comfortable eating.
So they feel like something's maybe stuck in their throat.
Exactly. So, and sometimes it does get stuck.
Now, what's fascinating with children, and from what I was, reading and researching, is that there are other symptoms that are reflecting of the not eating. There may be failure to thrive, they're underweight. Are those some of the things that a parent would be aware of?
Yeah. So it may be that you're going to see the doctor because you just haven't noticed good weight gain lately. And even though you're trying to feed your child more, they just aren't able to keep up and eat as many calories as they can. And so a lot of times the kids can be underweight or not making their growth milestones appropriately.
So that's really interesting. Now, as we go into our little role play, let's briefly talk about how would a pediatric gastroenterologist help a parent and a child who has EoE? Like, what would our experience be with you?
It's twofold. I see so many of my patients in the clinic and equally as often in the endoscopy suite. So I'm seeing them in two different settings. In clinic, that's when we talk about medications, medication options, which medication is right for you, which diet is right for you. And then inevitably, the only way we can figure out if that diet or that medication is working is then we have to do an endoscopy under anesthesia for the most part in order to prove that. So many of my patients I have a relationship with where we go both from the clinic into the endoscopy suite and then back again.
So children can have that procedure, endoscopy.
Yes. We do it in tiny little babies as well.
Oh, wow. That's very interesting. And another question for you is, what are the treatment options for pediatric patients who have EoE? Because I want to get into that as we talk about our transition. So what would a pediatric patient, how would they be treated if they were diagnosed with EoE?
So the treatment is pretty similar across the gamut, except for some new drugs that are just coming to market now. For the most part, we treat kids with EoE with proton pump inhibitors, which are basically antacids that we use as an anti-inflammatory on the esophagus. And they've been shown to decrease eosinophil recruitment to the esophagus. Diet therapy is an option for those who can think about removing things from their diet. So we typically try to think of what's the most common food in the diet. Is it milk? Is it wheat? And remove one of those foods and see if that helps. And then the other option for younger kids being a topical swallowed steroid preparation. So basically taking an asthma medicine that usually is inhaled and then making it into a thickened solution and swallowing it. And then the last therapy that's brand new that just came onto the market for the 12 and up category is a biologic, which is an injection once a week of a medicine called dupilumab. And that decreases the inflammation and decreases the eosinophil recruitment to the esophagus as well.
So that's interesting and positive for patients that they know that there are options that they have with their doctor. So now, audience, we're going to do something a little different and a little fun. We're going to pretend that I'm a parent of a child who is 18 and about to transition under the care of Dr. Muir to care of our adult gastroenterologist, who in this case, our next segment of this is with Dr. Lynch. And we're going to give a little scenario of what would that look like as we transition to care. So we're just going to take a little moment and I'm going to transition into my parent mode. And we're going to ask Dr. Muir some questions like we would normally if she was our doctor and we were going off to adult care. So here we go. So, hi, Dr. Muir. This is a big day for us. You know, my child is going to be transitioning from your care, and you've been amazing and fabulous, to Dr. Lynch's care. And I had a lot of questions for you. This is the first time my child's going to be going off on her own to see the doctor. So, what should we be thinking about, and how should we prepare for this transition?
The first thing I want to reassure you about is that just because today might be our last appointment in clinic does not mean we're severing our relationship. It doesn't mean you can't call me in the meantime. So it may take a few months. It may take 8-9 months to get in to see an adult gastroenterologist. And until that time, no matter how old you are, we will still take care of you. And so it does end up sometimes the process of getting an appointment and the process is a little rocky. We can still follow you and continue to follow you. So do not fear that if you don't get an appointment right away, you'll be without a doctor for the next few months.
So that's good. So I know my child was concerned that I couldn't be involved anymore. And is it okay if I either accompany her to the appointments or talk to the doctor? Is that something that I can still be involved in?
That's a great question. And the short answer is yes. And I, usually what I've been doing over the last few years, which you may not have noticed, is I've been involving both you and your child in the decision-making. And, when at the end of the visit, when we discuss which medicine, I go to your child first with the instructions, just to give them some autonomy as we make this transition. And that really starts probably at the ages of 15 and 16 rather than right at 18. And so hopefully some of those building blocks to gaining autonomy as we make this transition have already occurred.
Yes, it's been so helpful. These kids, they want to do everything independently, but when it comes down to their health, they get a little nervous. So the fact that we can still all be involved in the shared decision-making during this transition, I think she's very relieved about that. So thank you so much. Now, I know you and I've discussed, possibly doing more with the elimination diet now that she's getting a little older. She's been doing great on the medication that you have. Are we going to be able to still stick to that and then try an elimination diet with our new gastroenterologist, possibly?
Yes. And I think that while we don't have the perfect treatment for EoE, the good thing about the way therapy works in EoE is that there's no right or wrong choice. And most doctors like to work with you to figure out what's the best choice for you and your lifestyle at this point in time. So if you're transitioning to a new school, if you're transitioning to a new job and diet or drug is harder or easier, we want to work with you to overcome obstacles. But if a treatment therapy or if a therapeutic strategy is impossible given your lifestyle, then we want to work with you so that you're on something that will work. The therapy is only as good as your compliance. And so if you feel like we're giving you an unattainable task to achieve, then we would want to take a step back and say, well, what is achievable?
Oh, Dr. Muir, it's such a relief to hear you say that, because as you know, my wonderful daughter is getting ready to go off to college out of state. And, I'm already freaking out about that. Complicating this is the EoE transition. So can we give her a little time? Can we still stay under your care as we transition until she gets, I don't want to make any, I know stress could, trigger some of the symptoms. So how does that work? Because I'm like a little nervous about all of that.
Generally speaking, we don't like you to go through multiple transitions at the same time. So
Okay,
the transition to college or the transition out of high school is such a big transition. And we find that patients are at a high risk of relapse during that time because compliance is harder when they're on their own. So we want to keep everything as stable as possible. So we are very happy to continue to follow you as you get through your freshman year of college, so you can have some consistency and you can have a person to call and have a touchstone, even if you're away at school.
And they could share the records. Obviously we sign the papers that you both can get the records. So we are all on the same page. And if we have questions, both of you can be involved in the treatment care, hopefully.
Yes. And I think having a discussion from a doctor's perspective, as well as having a discussion with everybody is actually a good method, because then we can all give our opinions and you can have an informed decision to make as to what treatment you want to pick.
No, that's really important. Now, I know I have a million questions for you, but do I need to prepare anything? Like, what do I need to bring with me or my daughter? And what questions do you recommend that we ask our new doctor, Dr. Lynch?
So when you call to make your appointment, they will ask you to sign a release in order to get your records released from our hospital system. So you'll have to call our hospital system, sign a release form, and get our records sent to your new doctor. It is a little bit of a process, and sometimes that takes a little perseverance. But the other thing I recommend is that when I write my last clinic note, I try to put as many details in there as possible, and then I mail it with a stamp to your house so that you can have a hard copy of a very up-to-date piece of paper.
Oh, wow.
And you can scan that in and keep it somewhere safe so that in the worst case scenario, you show up, but your new doctor doesn't have any of your records, you have at least a very recent recap that is in your hands and in your possession without needing it to go through third parties.
Oh, that's so wonderful. I really appreciate that. Now, I know you recommended Dr. Lynch to us, and I think she's available for us, but do you also make other recommendations, or do we just randomly have to pick a new doctor? Because that's the one thing I have all these worries. How do I know it's the right doctor and they specialize in EoE?
There are not a ton of EoE specialists, so it can be hard. And I think that's why I am totally happy to speak with whichever doctor turns into your new doctor. So if you feel like you're going to college far away and you need a doctor in that new area, and there's not a local expert per se, I am happy to continue to work with that person going forward.
Wow. I guess maybe one of my last questions is, what should we expect? How does the pediatric care differ from the adult care, if anything? What should we be aware of going in? And I know that you guys have really held our hand through this whole process, but she's not a little baby anymore. So I feel like we probably have to be more proactive, right?
Yes, I think you have to be more proactive. It's things like calling to schedule your scope in a reasonable amount of time, as well as if you've been non-compliant, fess up. If you've had like a bad 2 weeks, you had exams, you're eating the cookies you weren't supposed to eat, rather than hiding that, it's better that we know that's why you have stomach aches and trouble swallowing now. So I think just having that relationship with your doctor and being comfortable, it can be a little more intimidating to come clean to a new person.
And she doesn't have mom watching her, and
Right.
I'm making all of her meals. I don't know what she's going to be doing in college, right. But the point you're making is she really has to be truthful with the doctors, because that's the only way, dear, they're going to help you.
Correct.
I know you're so busy, and I really appreciate your taking the time with us today. Anything else we should know? Any tips for success as we make this transition?
Get to know whatever electronic medical system you have to connect to your doctor, because those messages that go to your doctor are essential. So I think sometimes adolescents, as they make the transition into adulthood, haven't gotten to know how to do online systems to talk to their doctor, and those are becoming more and more prevalent. So I think getting to know some of those systems, even as you're a adolescent. So many of the adolescents are allowed to get their own system at 16 and up. So I think getting on that system and learning to use it, and then as you make the transition, that will be a way that you already know how to talk to your doctor.
Like the patient portal. So she should pay attention to the emails and all of those things. I'll see when I talk to the other side, Dr. Lynch's office staff, if they can also send me the emails as well.
They may not allow you to be in.
Oh, okay.
The patient portal becomes your own as you.
Oh, that's a big difference. That's a big difference.
You may not, your parent or guardian may not have access as they have. So that might be a big transition to I have to log on. I have to look at it.
That's great. That's a great point, Dr. Muir. Thank you for letting me know. Now I know another question to ask my daughter. Did you check your patient portal? Well, you've been so phenomenal. I really appreciate it. And this can be managed, right? She's going to be okay, right? She's going to be okay.
Yes. And I think there's nothing she can't do that everyone else can do. She's going to continue to have a very healthy, happy life.
Well, we'll sure miss you. You've been a great physician for us all these years, and I thank you so much. Okay, everyone. Now we're going to talk about what happens when an EoE patient who's transitioning from the pediatric gastroenterologist to the actual adult gastroenterologist for their EoE care. And we're going to talk with Dr. Kristle Lynch, who we actually interviewed live during the ACG 2022 annual scientific meeting in Charlotte, North Carolina. Hi, everyone. Welcome back. We're at the ACG 2022 annual scientific meeting at the Charlotte Convention Center in Charlotte, North Carolina. Today, I have a very important guest, Dr. Kristle Lee Lynch, who is a gastroenterologist and associate professor of clinical medicine at the Hospital of the University of Pennsylvania, and she is an EoE expert. And you're a gastroenterologist who's going to be referred a patient from a pediatric doctor, pediatric GI, who has EoE. Do you have certain suggestions or tips for that patient as they're transitioning before they see you?
Yeah, I mean, it's a very exciting time. Usually patients with EoE are not transitioning towards adult care during sort of milestones in their life. I think in my experience with the Children's Hospital of Philadelphia, these doctors will transition patients when they are away from sort of large changes or milestones in their life. And so hopefully it's a calm time for these patients. And I think it's important to recognize that you're getting an entirely new team. And that we don't know you. Having records when you first come in is really important. I will spend a lot of time looking at those records before we meet the patient to get an idea of what have you been through, and what have your endoscopy showed, what treatments have worked, and trying to sort of piece that together. But then meeting the patient is obviously the most important piece of the puzzle, and getting a sense of who you are and how you feel about what therapies you've had.
So before we do our little role play, is there a specific age or that a patient would transition, and how is that determined?
I mean, I think it depends on the center. So centers do them in their own way. In my experience, what has been successful with amazing pediatric GI docs is they'll introduce the idea when the patient is 16 or 17, just letting them know that they're not abandoning them, but at some point they will be transitioned, and they'll actually individualize it. So they'll wait till the patient is over 18, but perhaps not having large changes in their life. For example, usually it'll be after they graduate. And so oftentimes patients will come to me more around the age of 20 or 21. But it is adjusted to what the patient is going through to make sure that at what I consider sort of a risky time in the setting of a chronic disease, that they're trying to keep everything else stable for that transition to a new doctor and a new team.
So that makes sense. So if I was just going off to college, you would say, let's just wait until you get through maybe that first semester or first year, so we're not bombarded with so many changes, because that could disrupt the patients, if they're in remission, and it could make it worse.
Right. And some pediatricians I've noticed will actually sort of even assess, where is the patient going to college? What are your plans afterwards? Do you think you're coming back? Do you think you'll be staying in another city and then possibly getting a job there? So they really look at the patient as a whole and try to come up with a good plan for the patient's not only health, but sort of mental well-being in transition.
Well, those are really great points. So now we're going to do something a little different that we've done so far this week, because I think this is such an important topic. We're going to role play. You're going to be the doctor, because you are the doctor, the gastroenterologist, and I'm going to be the EoE patient who, I just turned maybe 18 or 20, and I've been referred to you, and now I'm coming to you for my very first visit. So this is what it's going to look like if you are seeing me for the first time. I'm growing and I'm going into your practice and under your care. So we're going to just do a little role play.
I mean, I think, the first thing I would say is, I have read a lot about you in looking at your chart, talking with your previous doctors, and looking at what therapies worked for you and how you were feeling. Can you tell me a little bit about what you've been through and how you're feeling, so I can sort of see if that matches up with the medical impression that I'm getting?
Sure. So I've been feeling good most days, but I know certain things that I eat I'm scared because I might have a food get stuck, and I feel a little scared about that. And, I'm in a new city. I have gone to college, and I don't have as much stress as I did at the beginning, but I'm just a little worried. I don't have my mom here, so I don't know the right questions to ask you, because she's been really my advocate, but now I'm here alone and I'm seeing you, so I'm a little scared.
I mean, I think that makes sense. Do you want to call her? Let's get her on speakerphone. Have a support group there for you. I think that could be great.
Oh, that's a great idea. Yeah, let me do that. Okay, mom's on the line.
All right, perfect. So we have mom here. And so first we'll talk to your child, mom, and then afterwards I'm going to ask if you have anything else to add, and then we'll sort of continue the interview. But I would basically say it's a lot of transitions right now, and the foods that you're eating are not the foods that you were eating before, because you don't have the same access to food. So we need to piece out, is it an issue with the foods that you're eating, or are you not controlled on your current therapy?
Do you think I can let my mom go now?
No, mom is staying on until the very end.
Okay. It's just because sometimes she thinks my symptoms are not as intense as they may be, or sometimes she thinks they're worse. So I want to be able to tell you how I really feel without my mom telling me that's not how I feel.
I think that's fair. I would ask mom if we could have you as a listener for the first part, and then after that, maybe you could tell us what sort of thoughts you have in your experience observing your child.
Okay, I think that's
okay?
fair. Sure,
Okay.
Thank you. I really like that you're amenable to that.
Yeah.
So, before, when I would go to the pediatrician, we had a certain way of doing things. When I come to you, what will I expect? How will our appointments go?
Yeah. So the first thing I'll say is it's not as colorful as wherever you were.
No coloring
The
books?
adult world has not a lot of paint on the walls, and things do not look as nice, but we are nice doctors. The clinic will just be this room. This is, sort of where we'll talk, and then we'll come up with a plan that you're comfortable with. This is shared decision making now. You're in an adult world, so I educate you, and then you decide and we decide what you would like to do and what's the best option for you. It doesn't have to be what therapy you were on before. And for endoscopy, it's a little different. We do not give gas. You do get an IV while you're awake, and that IV is really important for putting you to sleep. You are welcome to bring your stuffed animal. We don't have extras. I will say that.
Okay, I'm sure. Okay. So, I know that the pediatrician that I had before, Dr. Johnson, she said that I should work with a dietitian because I really want to try the elimination diet. Are you someone that could you help me with that?
I can certainly help you with that. And we have adult nutritionists who are trained in the 6-food elimination diet. But first I would ask, where are you living? Because in my experience, it's really hard for people in college who live in a dorm, who are reliant on the dorm food only, to successfully do the elimination diet. That being said, it has been done, and my patients are amazing. So, but that's always the first question.
Yeah, so I'm a freshman, so I do live in the dorm, but we have there are healthy options, I think. So I really want to be able to manage this as an adult and be successful, but I know that it requires a lot of work and a lot of patience. And I know there's going to be parties and things, but I'm used to that from high school. We had a lot of parties, and I listened to my mom and the doctor. So do you think that that this is doable?
I think if you think it's doable, it's doable. The 6 food elimination diet is quite intensive, and the reintroduction process can take 9 to 10 months with endoscopies. So it definitely can be done, but it is difficult on your social life because you have less control over what you can eat when you're in limited social situations as opposed to being at home and having your own tailored cooking or cooking yourself. So it's something just to be realistic about, but absolutely, if that's the path you'd like to take, we should do that.
So what are the other options now that I'm under your care as an adult? What are my other options for, being in remission or keeping my flares at bay?
Yeah, so for EoE, we certainly can consider proton pump inhibitors. We're not using them necessarily for the acid suppressing effects,
Okay.
but more for the anti-inflammatory effects. We also have topical swallowed steroids, fluticasone as well as budesonide. And all three of the medication groups I listed are off-label use. And then dupilumab is the first FDA-approved medication for EoE, and that's certainly an option as well.
So how does it differ from what was happening with my pediatric care? Are there more options now that I'm older?
So dupilumab is approved, I believe, for ages 12 and up, but now that you're under my care, so it depends.
Okay,
I'm gonna cut that part. Yeah, it depends. Yeah.
So what, Mom? So I think my mom said that we could talk to the pediatrician and you guys could work it out,
Yeah.
maybe.
Yeah. I'm always happy to talk to your pediatrician, and they're always there for you. I know you have their contact info, and that's one thing I think they stress. During this transition period, you have a new team, but it doesn't mean your old team is gone, right?
Okay.
So
Oh,
we're
that's
all
good.
in this together.
Oh, that makes me feel so good. And so how often do I see you?
So it depends. In the beginning, you may see me more than you want to until we can get your disease under control, both in the sense of biopsies and how we look at it under the microscope and how you're feeling. And once that's sort of settled, you'll check in with me about once a year in the office, typically because EoE is a relatively young disease and things are changing very quickly. And so you want to be up to date with what your treatment options are. There's a category of medications called biologics that are, one example is dupilumab, and these medications are going to sort of shape the future of EoE. So we need to just make sure that you're feeling well and just check in with me to see if there's any updates in your options for therapy.
Yeah, so some things I'm, excited to be an adult about, but I'm still a little nervous about this whole EoE thing and, not having, and I'm not being a baby about I would need my mom, but, when I have to sign about going under endoscopy or making decisions, it's okay if I consult with my mom and we can all work together because I am still a little nervous about the whole transition.
I mean, I think that's normal, and you absolutely, do need to bring her. I think that's really important to have her there as your backup and to make sure you're comfortable. We don't do anything unless you're comfortable, but sort of having her there to cement in what you think is right, I think is important, or to sort of catch you when you're not sure really what to do. So that would be great if you could bring her.
Thanks. Or if she can't come, we can just get her on the phone like we
Yeah,
did
we
today.
can get her on the phone.
That's so great. And the other thing is, I know, I'm 18 or a little over 18 now, and I am responsible for my health. So what happens if you recommend something and we get my mom and I disagree with her, but you and I agree?
Yeah,
What
I mean,
happens? Does that happen a lot?
it does happen, and I think that it's a situation where it's really nice for the three of us to get together and talk because we can just talk about the pros and cons of each option. And usually the three of us can come to a consensus. All the groups come to a consensus, whether that's moving towards what we were thinking or moving towards what mom was thinking. But I think it's important to recognize that it is tough for your mom too. Before, she was making all of these decisions, and now she has to let you make your own decisions, and that's a transition for her. I know you have a bigger transition, but it's tough. It's tough for parents.
And I just have one more question before we go. What is your, I really want to do good at this. I want to do good. I want to be a good partner in my care. I want to not have to have a lot of struggle. What are your tips? How can I be a better patient? And I know I'm a grown up now, and I want to do the right things by you, and I want to be like your teammate in my care. So what are some of your tips that you have for me as we move on in this transition?
I mean, I think you're doing a great job. I think listening to what we have decided to do for your plan moving forward is important, but also asking questions. If you're not sure, send me a message in the portal. Give my office a call. Nothing is a dumb question, right? So make sure that you're asking the right questions, and I think that you'll be very successful.
I'm so grateful. Not that we want to go to see you, but I really feel comfortable with you, and I thank you for, making me feel comfortable during this transition. I'm really grateful, and I look forward to telling you all about my new experiences in college and all that good stuff. Thank you so much.
You're welcome.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.